Two. Hi, I'm Dr. Shamek Kotecha from the Kotecha GPS Club for another version of our marketing shorts. Today, joined again by Natalia Decius from Vitamin D Marketing and Design. Hello again.
Hi, Shamek. How are you?
I'm okay. And yourself?
Doing good too. Thank you.
So today our topic is newsletters. And newsletters have been in dentistry for a long time. Newsletters, and I'm going to include in newsletters mailouts, like just constant things that you are communicating with different people through mail and email, like things like that. So in terms of newsletters, I'm going to divide these up into a couple different categories. We're going to talk about the external community newsletter or mailouts. Then we're going to talk about an internal mailed newsletter. And then we're going to transition to what more and more people are using probably more frequently is the e-newsletter, which can be both general to people or just to your specific patient base. Okay, so let's talk about community newsletters. When I started dentistry 20 years ago, that would have been the only thing we had was a community newsletter or a mail out. We would send things out. And, you know, I think back to when I first started practicing and when I started living on my own, I checked my mail. When I go check my mail, there was always a ton of flyers. I used to see a lot of dental newsletters. And I, at that point, was an associate. I really wasn't involved in much of the marketing, so I didn't really think much of it. So if we fast forward to today, do you think community newsletters are still useful for the average dental practice?
Yeah, I still do quite a bit of external community mailouts. The traditional community newsletter format, I find that it works best in a smaller communities, so smaller towns. Anytime you go to more of an urban center, newsletters are not really being used very often. It's mostly kind of like a very quick flyer with some sort of a special offer because the target demographic is quite different. And just for those reasons alone, two different programs for different demographics.
And so in most of these, you have somebody or you print them yourselves, whatever content you want to put on them, and then you take them to the post office, and the post office has different ways of mailing them out, correct? How do you track that? And can you target specific areas with those, or is it more general?
So I will say that if you're taking the mailing aspect onto yourself, you're probably kind of not utilizing all the tools that are available to you. Typically, when you're working with somebody that does this, has a lot of kind of resources that they can tap into that maybe you individually might not. If you do handle it on your own, if you go to Canada Post Depot, it will be as simple as you dropping up the flyers and kind of working with the storefront clerk and letting them know as to where you want them saturated. But if you're working with somebody, for instance, like myself, where we dive in a little bit deeper in the sense of figuring out your reach as to how, what kind of radius you want to cover. We can dive in deeper into demographics of your ideal target audience. So whether it's family households, whether it's, households with kids living at home, specific disposable income, even certain ethnic backgrounds. If you're, for instance, a Hispanic dentist and you want to connect with your Hispanic audience, you're able to identify where those households are as well. It's called precision targeting. So I would definitely tap into that to make sure that you're getting kind of the biggest return on your investment.
So along the same lines, when you do this targeting, does Canada Post have different fee structures? Like, do they have a general bland, you can send everything to any area code versus I want to send a letter to all families that have an income over this level? Do they charge you differently, or is it just basically a service they have?
Both of them are categorized as unaddressed ad mail, and unaddressed ad mail has a specific fee attached to it. So whether you utilize the precision targeter or whether you just target specific postal codes, the fee, or letter carrier walks, the fee is the same. Generally speaking, if you don't have a Canada Post commercial account, and depending on the volume that you mail out, typically what you would pay if you went to Canada Post Depot is probably a little bit higher than a company that does these mailings on a lot of, on a regular basis.
So get someone to do it for you.
Mm-hmm.
And do you have any way to track it, or are you basically the only way to track it is basically by phone calls to your office that you ask?
So on the Canada Post end, there is no way to track unaddressed ad mail, except you do receive a statement of mailing and you can verify that it was processed and that it was handled, but you can't actually track the pieces themselves. So the only way for you to track the response that you're getting on the mailer program is obviously target the telephone calls that are coming to your office. B, if you strategically use any type of a special offer or something, kind of something that would make somebody hang on to the piece or bring it with them to their appointment. And another option is to have a specific unique marketing telephone number that you're using specifically for the tracking of that piece, so you can actually track the calls that are coming to that number.
So just to follow up on that, the number-ish thing. Are these numbers through like Bell Canada, or are they mostly like an online phone number that you can?
You have options available. Mostly there's the companies out there that's what they basically specialize in. So you're basically buying the use of a specific telephone number, and you can buy it for a certain amount of time. If you're fairly consistent with your marketing, you can even like buy into it for like a year, whatever that is for you, and you're paying them a small monthly fee, and it does come with a tracking options where they're actually recording the calls too. So even if you want to see how they're being handled on your end internally, you can actually listen to those calls as they're coming in and how they're being answered to.
That's interesting. How big an area? And so we're going to separate these because obviously someone in downtown Toronto has a different radius than someone in a small town in Northern Ontario. So let's talk about how big an area. So if you're in a urban area, suburban and rural, how big an area would you definitely recommend?
So the general rule that I find being used the most, if you're in a suburban area, with a decent amount of population that's saturated fairly heavily with dentists, I would say stick to a 3-kilometer radius around the office. Don't go beyond that, because people just have way too many choices, and nobody really wants to drive 20 minutes to get to the dentist anymore. But if you are in a more of a remote setting where people do travel to you a distance, you can certainly extend that reach to even beyond 10-kilometer radius, because that's that would make sense for your practice.
I'm used to traveling. And the last thing before I move on, and I this is my own thought sometimes, I use a community newsletter. I am a semi-rural practice, and I find that it does work. But where I live, I get this pack of flyers every Thursday in this bag, and sometimes I open it, sometimes I don't. And whenever I open it, there's at least 6 or 7 dental flyers. My question is, how is me being a dentist get something to what I would call pop, or someone to say, make them pick my mail out versus adding it to the recycling bin, which the rest of them end up?
Yeah.
Are there any content things you think work? Don't work?
So in general, there's certain rules or fundamentals to marketing that that kind of imply as to what affects the type of response or the return on your investment. And one of it would be just purely the format of it. So something as simple as the size of the piece. So when you do get a stack of mail, does your specific size format stand out from the rest of it? The other piece would be something about design. Does the piece actually look professionally? It's designed to kind of promote, connected with your target audience. Timing is a big thing, making sure that you're sending it out at a time that makes sense. so you're connecting with the right type of people. And the message is huge. So for instance, going back to community newsletters in the smaller communities, anytime you can incorporate different type of content that has some staying power at home, so whether it's just, a really cool recipe, or like a little exercise, coloring thing for kids, whatever that is, just something that has a staying power, that will be looked at more so than anything else that you get in the mail.
Gotta be different.
Mm-hmm.
That's good information. I still think that community newsletters have a place, but you have to be, with all the budgets on marketing dollars and all the different places you can put it, you just have to be very cautious on how you use it and use it wisely. It's like anything else, right?
Yeah, and track it. Tracking it is huge, because, and that's what venue marketing. Anytime you're investing dollars into your practice, you want to see what you're getting back. And sometimes you explore different things and you realize certain things are not working. So maybe not stop investing money into those avenues and consider a different approach.
I also think that dentists should have realistic expectations on what their marketing results are. And, every area has different metrics, but I think every dentist should learn the metrics of their area or their type of practice. I mean, if you send out 10,000 and you are expecting 400 people to come back from it, that's probably a little bit far reaching. You have to know that. And then so that way you're not disappointed, because if you're assuming one thing and you get something different, you're never going to be happy. So if,
Right.
Going forward, if you think that you want to have certain numbers, you got to figure out what you need to do to get those numbers. Because one thing I've learned is that just because you send it out doesn't mean it's going to be read. So
Yep.
you got to really know those numbers. So I'm going to transition into another type of newsletter. Just instead of externally marketing it, you're internally. Now, I don't know if people still do these, and I'm going to ask you about them. Internal mailed newsletters, where you're sending information to your existing patients via mail. A lot of dentists have probably, due to the cost of postage, have gone to different things. Now, do you think internal mailed newsletters are still an option? And what are their pros or cons?
There's certainly still an option. There's certainly an option for offices, because I still find there's quite a few offices that are not very good at collecting email addresses, or maybe you took over the practice when now you're implementing collecting the email addresses, but that wasn't implemented before. So if you have a message that you really want to make sure as many people see, and you don't have as big of or as good of a database as you'd like, then certainly there's place for newsletters in print. But I also find, even with clients that have a healthy email database, that doing like an annual patient direct newsletter has a value, especially if you have something that's like really worth sharing. If there's a message that you want to really be heavily promoted and be well received, because you can never compare the open rate of a printed direct newsletter versus email one. The email one will be read, but it will never have the same percent open rate as the print one.
Because most of the mail that we get are bills, and we're so happy to see something that's not a bill that we're like, hey, look at this.
That's right.
And
yes.
they read it. I think that's what it is. So,
Yeah.
I've discussed this with you previously, but your recommendation for an existing practice is about once a year to still mail out something like that, or is it changed, or does it depend on the size of the practice?
If you have a healthy email database, I would do the printed one once a year. And maybe that's something kind of to start the year off, or anytime you maybe have something special happening, an event, whatever that is for you, I would do it once a year. If you don't have a healthy email database, I would recommend that you do them twice a year, because you certainly want to stay in front of your patient file. And it's really a great way to, I think, for the longest time, everyone has always been focused on external marketing. It's just all about new patients, new patients, new patients. But a lot of times people forget that their biggest opportunity is actually within their existing patient file. So whether it is increasing an average patient value of your patient file, or whether it's promoting specific treatments, growing your referral base. Any internal patient communication is a great way of achieving that.
So yeah, I agree. And, it's still got a place. So now the transition from still using internal marketing, the printed, we're going to go to something called the e-newsletter, which I think has become the vast majority of how dentists communicate with their patients internally. So I'm going to kind of go over a couple different ways of it. I'm actually going to give you a scenario later. So, because it's not as simple as people think. It's not like you just type up an email and push send to every email address you have, because if it was, we'd all be doing it. And there's risks of being too frequent, because then your message isn't read. So there's a lot of things you have to understand before you get to the point where you're comfortable. Now, me being a dentist, I fix teeth. I don't understand all those nuances. And so if you are someone who isn't tech savvy, my advice is find someone to do this for you. There are lots of services, Natalia, but there's lots of other companies that do this. I will tell you one thing is, regardless, you should find a marketer that has some footprint in the dental world, because marketing dentistry is different than marketing any other business. There's lots of different reasons, but the big one is you have privacy concerns and you have guidelines by your governing bodies. So whatever you're going to do, make sure you understand that. And that's why I think it's important to find Natalia or someone like her to help you, because e-newsletters can be very easy to send something. And once it's sent, as we all know, you can't take it back. So
that's right.
So all of us have learned the hard way. So I'm going to start with, how effective do you think these are in today's marketplace? Like, you talked about something earlier about open rate, and that's where I find the effectiveness is. So why don't you go into talking about how effective they are and how you can make them more effective?
They're very effective. And I think especially now in the current, events as to what's happening around the world, I think they're so important as a way of staying in front of our patients, staying in front of our community, and just for people to have a sense of, communicating everything that's going on in the office. But even with that in mind, if in the marketing community, if you're ever doing e-blasts, any industry expert will tell you that if you get 20% open rate, that's considered a good response. So, 20% for a dental office, I would not consider that a good open rate. So I think you would like to be at least somewhere around that 47%, 50% and above, to make sure that your message is being read. So to increase the number of people that are actually opening up your email and doing something with it, number one, you want to get your timing right. So you don't want to saturate them with news every single week, because that's too much. And to be quite honest, I don't need to hear from my dentist every single week. And you probably don't have that many updates in a week anyways.
Unless I'm making them up.
That's right. So I would say do them on a quarterly basis. So with each season, you're sending an email out. Now around the pandemic, obviously we have to do them a little bit more frequent, because there's new developments or new happenings happening more frequently. But under normal circumstances, I would say do them every season.
Yep.
And just what really improves the open rate is it's the message that's inside. Something as simple as your subject line. What is that subject? Something that will actually intrigue somebody to open it. Yeah. And then anything that relates to office news, team news, celebrations, any type of community involvement. If you're highlighting let's say patient success story that you've received consent for, and then even doing something that's not dental or office related. So perhaps, you have somebody in your office that's just an amazing baker, and maybe they want to share a recipe of something that, everyone, just dies for. Just do something that connects to your team, but at the same time, it's not dental specific.
I've found that e-newsletters do work. It's a great communication tool. I think most of our patients it's about, they want to know the office culture. And I think that is key, that if you are, if you always, I have friends, colleagues who are very talented clinicians, but if all you ever talk about is clinical stuff, not everyone comes to the dental office for just the clinical stuff. There's many reasons why people choose the office they go to. And so showing your office culture, and I think your team are a big part of why you do how you do well, because, seeing they spend just as much time interacting with some of your patients. So having them a part of it makes a big deal. And I think people want to know. I know, and not everybody wants to share stuff, and you have to be careful on what you do share and what you don't share. But if it's in a general way, I think that it helps just form an opinion of your group. Now, in terms of how do you track that? Because it's obviously different. You don't have to ask them if they call your office if they've seen your e-newsletter. They're not going to want to call your office, for one. But are there ways that, that we can track that?
Yes. So email marketing is actually really easy to track, because depending on what technology you're using to send emails out, pretty much every single technology comes with a reporting module as part of it. So, there's the more probably known platforms to people are platforms such as MailChimp, Constant Contact. I know there's also a lot of dental specific patient communication modules that are available as well to dentists that they're using. Each one of them should come with a reporting and analytics that you can read into in terms, and they're quite telling. You can see exactly the percentage of open rate. You can see who opened it. You can see who subscribed or unsubscribed, who shared it, who actually did something with it. It's pretty telling in terms of who, what the actual open rate of your email was.
This is another reason to have someone else manage this, because it's humbling when you see who unsubscribes from your information and you're like, that person doesn't want to read what I said. It's like, so just to give you, unless you're very thick-skinned, get someone else to do it. It makes sense. Understanding them too. I mean, you need to, one thing you realize is you really need to have a good email database. So that's going to kind of transfer me into my next question. It's more of a case study, because, a lot of us in my generation or younger have recently bought practices or in the purchase of buying practices or taking over practices from a generation of clinicians that not everyone had to do a lot of marketing. I mean, they didn't have to be, a large part of it, they just open their door and put a shingle up, say dentist, and they became busy. I don't know, that doesn't happen anymore. So I got to say, I've been a practice for 10 years, or I just purchased a practice. I'm not very tech savvy. How do I implement this? So go through like the steps that I would take to get there. And I apologize for the dings. It's been the COVID-19 season. Something must have happened, because it's been going crazy for the last hour.
No problem. If you're new to that territory, you don't have quite a lot of experience, I would certainly hire somebody, because email marketing is really inexpensive, and it's going to save you a lot of time and frustration. But to get started, you want to make sure that you have a system in place where you're asking people for their email lists. If email addresses, if you don't have one, make sure that you have a system in place. So something as simple as having that listed on the new patient forms or their consent forms, having them sign off on that. Also, even like if you have obviously existing patients that never give out an email, when they do come for their appointment, if you notice you don't have their email, just ask them, just say that you're communicating much more by email, and are they comfortable sharing their email address with you? Chances are 99.9% of people will be comfortable with that. So collect email, make sure that you collect email addresses, and then you update whatever system you're utilizing to send out those emails, that you're keeping it current. So for instance, if you're externally adding emails to it, make sure that you do it on a regular basis, because if you haven't updated it in 3 months, chances are that you're missing some people. So and these external platforms have systems in place that anytime you add a list, it automatically removes any duplicates, so you're not at a risk of, sending the same message to somebody more than once. And then just figure out whatever platform you want to use for sending out this communication. With MailChimp, depending on the size of your email list, for the most part, it's free. So the only cost to you would be to have somebody actually put it together in a
It's not as easy as it looks.
I'm sorry?
Not as easy as it looks. Because you know me, I'm a little bit OCD. I like to know how things work. So I've tried to create some for Kotecha GPS Club. And what ends up happening, and I'm gonna full disclose that, is I start it and Natalia finishes it, because it's the truth is it's not as easy as it looks. And if she's unavailable and she's busy and I have to do it, I just copy one of the ones she's already made for me. So fool me once. So it is something that's good. Now the good news is it's 2,000 emails before they start charging you, correct?
Yes. Yeah.
At this point in time, in the end of May of 2020. So if you're watching this later, I'm not sure if the numbers are valid anymore. Also, some of your practice management software have modules that you can use to send out e-newsletters, correct? I know one of the ones I use, and I'm not going to name any of them, but one of the ones I do use has that option. Is a paid version, so I don't use it. But some people think it's easy. If you want to streamline things, it's
and Constant Contact, I don't think they offered the free one. I think theirs is about $30 per month. There's some specific ones that are not necessarily part of your software, but they're somehow they're connected. You pay a fee for them. I think they become much more expensive than that. I think you pay, $100 and more per month, depending on the features that you sign on to. So do you know all your options before you sign on to something? And also make sure that you're using it, because if you're paying $100, $200, $500 per month just to have the technology in place, but you're not using it, then you're just basically making a charitable donation to a business that you're signing on to.
Yeah, they love that. It's like my gym membership.
That's right.
They don't care if I show up or not. They'll take my money. So, in conclusion, I would tell you, whatever type of newsletter you're doing, it's both internal and external marketing, and there's definitely a process of doing it. They do have some good return on investments if they're used correctly. So if you don't have any other way to communicate with your patients or the people around you, they're not probably going to come and see you because they don't know anything about you or what you can do. So it's an important thing. I think most dentists get that to some point. I do think most also don't do it themselves, which is probably a good thing. Stick to what you can do, which is fix teeth. So Natalia, thank you once again. Any last thoughts on that?
No, I think we've covered it all. So
perfect. So look forward to some of our other videos. This is just one of many marketing shorts we got coming. Thank you, Natalia.
Thank you.